everyone. Our topic of discussion today is autopsy. See, what is autopsy? Autopsy is examination of the dead body or examination after death to find clues regarding how the person was killed, or it is a natural death or anything, right? So autopsy is what? Post-mortem examination. It is also called necropsy, thanoplasty or sectio cadaveris. Now, who can perform the autopsy procedure? The eligibility is minimum requirement is should be a registered medical practitioner or an MBBS doctor. Now, see, there are 9 types of autopsy, or there are a lot of types of autopsy. Why there are this much type of autopsy? Because a person can be dead by a lot of methods, right? A person can die due to just a disease over long time, let's say 4 5 months he was in the hospital, then he died due to the disease. Second is a suicidal death by hanging, or it can be a homicide death, person can be killed. So do you expect that every person should undergo same postmortem examination? No, we are examining the body based on the requirement, right? So that's why we have 9 types of examinations method. Now we'll study first to see. First is medico legal and clinical autopsy. See, what is medico legal autopsy? Whenever there is an unnatural death due to like hanging or killing or homicidal death, gun wound or poison or anything, here in unnatural death, we do medical legal autopsy. If there is a natural death, let's say death due to diabetes or hypertension, myocardial infarction, in this condition we do a clinical or pathological autopsy. Now, in unnatural death, let's say a person is killed by a gunshot wound. Now we can clearly see that the person dead body is having that gunshot wound mark, but then also we have to examine all 3 primary cavities, because it can be possible that the person is given the poison and he is died before killing it by the gunshot wound, or to disturb the investigation they have put the gunshot wound mark over there. So all 3 cavities are examined in case of an unnatural death, while in clinical or pathological death we just examine the suspected cavity. Let's say a person died due to myocardial infarction, then we'll just examine the heart. Myocardial infarction, then we'll just examine the heart, right? What are we opening the brain of that patient for? Useless, right? So suspected cavity is only examined in the clinical or pathological autopsy. Now see, who gives the authorization? I'm giving you one important example. Let's say a person is killed by a gunshot wound. Now if the relatives of the person say that we don't want any doctor to examine his dead body after, is it possible? No, because the authorization to examine the body is given by the law, or police, magistrate or judge. They give the permission to the doctor that you have to examine this body, because it is the right of the state to give justice to the person, right? So even if the relatives say no, the authorization is given by the law. In a clinical death, if the death is due to any clinical reason, there is no any homicide or no suspicion, in this case the relative consent is required. Relative can say, okay, I don't want my son or father to be examined by the autopsy procedures, right? So in natural death relatives can give consent, but if it's a homicidal or if it's a homicide or killing, then the authorization is only given by the police. Now the body is handed over to investigation officer till the crime or every procedures are completed. Body is not given to the relatives, while in here we give the body to relatives. Now see, in this case there is an unnatural death, we are doing examination to find the cause of death, right? But why are we doing examination over here? It is proven that it's a natural death, it's death due to myocardial infarction. Why are we opening that poor fellow for? Yes, we are opening it for the course of the disease, to examine or to study how the disease progressed. There are certain findings, it helps in understanding the disease proper. So that's why clinical or pathological autopsy is done. Now in India most common is medico legal, while in western countries we have clinical autopsies. Now what are the objectives of medical legal autopsy? Medical legal autopsy is done in case of unnatural death. So let's say there is any bomb blast or burn. So we need to identify the body, right? For any property claims, we need to know what the person is. So identification of body in mutilated burn cases. Then we would find the cause of death, how the person is killed. We'll study everything in detail in the upcoming lectures, that how we determine the cause of death from the body. Second is manner of death. If it was suicidal or homicidal. Injuries, any injuries we have to write it down. So, and weapon or poison risk. used responsible for death, and we have to collect all this evidence and forward to the court. And who collects this evidence? The investigation officer or the police in charge. Now, see what is virtual autopsy. In this image, you can see these are CT scan machines and taking images of the person. Now, this is done in the cases where we don't want to cut the body or anything where the relatives are telling that they want the body to be in proper shape or etc. So in this situation we do a CT or MRI. So it's a minimum invasive technique, the body will stay intact. Objective here is to assess the injuries of the body etc. But the disadvantage is that the CT scan can only see the structural lesions, any injuries etc. But if the person died due to poisoning, this CT smell will obviously not smell that poison, right? So only structural lesions can be identified. Now endoscopic, see endoscope is put inside the body over here and the internal organs are examined. So we use an endoscope or a laparoscope. Advantage is the same as in CT scan, the body remains intact and it's a restrictive approach. Needle autopsy, the same principle. Here the biopsy needle are used and the biopsy is taken, it is examined in the lab over here. So the approach is same, that we don't want the body to be cut or anything that the relatives are telling, we want the intact body for our procedures. So we have endoscopic and needle autopsy. Now in case of hanging, let's say a person was found hanged in the room and the relatives are saying that he has not done suicide, he has been killed. As in Sushant Singh Rajput case, what happened was that everyone is saying it was murder etc. So in here we do this type of autopsy which is psychological autopsy. What we do is, there are people who will interview the family members and relatives, and they'll ask question about the decreased state of the person, was he taking drugs, changes in his behaviors etc. So based on that they will confirm the suicidal death. Okay, they are not investigating any other cause of death, they are just confirming whether it is a suicide or a homicide, right? So to confirm the suicidal death they will interview everyone and ask this, and accuracy is moderate because it's never reliable. Now, verbal autopsy. See, this is different from psychological. Psychological here, the only purpose is to confirm suicidal death. But verbal autopsy is used in places where there is less resources. So for research purpose or statistical purpose, what we do is we interview the relatives by qualified people. So person is dead, their relatives are interviewed by the qualified people. And what do we ask? We ask that was he having any diseases before that, what drugs he was taking, what symptoms he was having, right? So from all this they'll determine the cause of death, because the actual autopsy is not done due to resource lack, and this is also not very accurate. So in here we ask question about everything, what type of drugs, what was happening. We also ask about his relationship with other person, he might have been killed. So there are a lot of questions, but in psychological we just want to prove that it is a suicidal death. Now, obscure and negative autopsy. See, let's say this example, a patient was admitted in the hospital for let's say 3-4 months, and then after 3-4 months the patient died. Now we don't know exactly what caused the death. There were a lot of pathologies, like she was also having heart problems, blood pressure problems, and a lot of different system problems. So what we do is, there are no minimal or significant finding that can tell that okay, the person died due to this reason. So lab tests are run, so this lab test will provide result. Okay, the person is dead due to vagal inhibition or status epilepticus or uremia. So in all this condition there are no external findings that can tell okay, the person is dead due to this reason only. Here the lab tests are providing the result. So if the lab test provides the result, then it is a obscure autopsy. But in some condition there is no evidence found in lab results, also no evidence in lab test history, nothing is found. So there is no opinion about cause of death. We cannot tell how the patient died. So it occurs in all, out of all the autopsies, it occurs in 2 to 5% of autopsies, and this is negative autopsy where the cause of death cannot be determined. Let's say a person was sleeping, in the morning he was found dead, and after running all lab tests, history, everything, the cause of death is not identified. So this was negative autopsy, obscure and negative autopsies.